listeners and viewers, my name is Trish Murphy with the Orlando Medical News, and today I'm with Dr. Rogers, and we're going to be talking about mammograms. Dr. Rogers, I'm going to ask a very basic question, but I think we should cover it. What exactly is a mammogram?
So a mammogram is a study using x-rays to evaluate the breast, and the goal of a mammogram is to detect breast cancer. So a mammogram uses x-rays. We take 2 views of each breast, and that's a basic screening mammogram.
Dr. Rogers, are there different types of mammograms?
Yes, so there's 2 types of mammograms. The first is called a screening mammogram. So a screening mammogram is when a woman doesn't have any issues that she knows of with her breast, but she's just going in for routine imaging of her breasts to see if they're, just to detect cancer. So it's called a screening mammogram, and it's something that we recommend be done annually, even if you don't have any family history or if you don't have any symptoms in your breast. It's still something we recommend doing. And that's what we talked about before, where we take 2 images of each breast using x-rays, and that's a standard screening mammogram.
Okay.
So another type of mammogram is called a diagnostic mammogram. And as the name implies, it means that we're trying to diagnose something based on a problem that a woman might have felt something in her breast, or she might have pain, some new symptom, some change in her in the way her breast feels, or something that she notices differently that's caused her to go to her primary doctor usually, and then her primary doctor would write a prescription for a diagnostic mammogram, and then she'll show up to one of our clinics, one of our facilities, and get a diagnostic mammogram. Another time we use diagnostic mammograms is if on a screening mammogram we detect something that looks like it's changed from a previous year, or looks like it could be potentially an abnormality. We will issue a report that says that on the screening mammogram we saw an abnormality and the patient should come back for a diagnostic mammogram, and then we take extra views. So the main difference then is a screening mammogram is for an asymptomatic patient with just standard views. Diagnostic mammogram is either she has a complaint or we saw something abnormal in the screening mammogram and we want to take extra views.
Okay.
Another difference is with a screening mammogram, the patient won't get her results the same day. She'll probably get them in a few days with a letter or a call from her primary doctor. But with a diagnostic mammogram, we try to get those results the same day to the patient. Usually if she comes into a facility where I'm located, I usually try to go and talk to her in person if it's something she's felt, just to explain what we see and usually to calm her fears and tell her that everything we're seeing is okay.
Dr. Rogers, what are the benefits of a mammogram?
So the 2 primary benefits of a mammogram, well, first of all, the goal of the mammogram, as we talked about before, is to detect breast cancer. So the main goal of mammography is that it has been proven over 50 years of research with multiple different studies. Mammography has been proven to save lives. Different organizations and physicians might debate about how many lives we save with mammography and might argue about how often to screen women, but I think everyone is in agreement that mammography does save lives. And most studies would say that about 30% of breast cancer deaths are avoided by regular screening mammogram. So, for example, if we have a group of people that is getting screened regularly versus a group that's not getting screened regularly, the studies would say that 30% decreased death to breast cancer. Another kind of weakness with mammography is in women that have what we call dense breast tissue. So not all women have dense breast tissue, but about 50% of women have more glandular tissue than other women. Mm-hmm. And so that means that their mammograms show up white, which is the same, the tissue in the breast shows up white, which is the same way that a cancer would show up.
Okay.
So that makes it harder for a radiologist or another physician looking at the images to detect breast cancer. So I guess that, so along those lines, mammography is not a perfect test. It's a great test, but potentially 20% or so breast cancers are not detected on mammography.
Gotcha.
By mammography alone.
Dr. Rogers, you mentioned women with dense breast tissues, it's more difficult to detect breast cancer. Are there other diagnostic tools in your toolbox that you guys can use as a radiologist to detect breast cancer in those women who have that dense breast tissue?
Yes. So, as we talked about, dense breast tissue makes mammography less sensitive. We mentioned that women with dense breast tissue, their glandular tissue on the mammogram shows up very similar to shows up very similar to cancer and how other masses look. So, two modalities that we can use to supplement screening in women that have dense breast tissue, and that are also helpful in certain cases for women that are high risk, are breast ultrasound and breast MRI. So breast ultrasound and breast MRI both have actually been around a long time, but they continue to improve the quality of the imaging. Breast ultrasound is the most commonly used as a supplemental screening tool, and many states have started requiring insurances to help cover the cost of breast ultrasound as a supplemental screening tool in women with dense breasts. Florida is not one of those states, but Florida has recently issued a mandate that we notify women that they have dense breast tissue, and so we anticipate that there's going to be a lot of women in Florida in the upcoming year, because this actually just passed this last summer, that are going to be coming to their primary care physicians and OBGYNs and other physicians and asking, so what does this even mean? So one thing that we can offer women with dense breast tissue that's cheap and easily accessible is breast ultrasound. And so breast ultrasound is able to find a lot of these masses that hide in some of the glandular tissue on mammography that are not as visible. And of course, the best test is a breast MRI. On head-to-head evaluations, multiple different studies have shown that breast MRI does detect the most cancer. It's the most sensitive. Just like mammography, though, we talked about how there's some false positives. Mm-hmm. Both breast MRI and breast ultrasound, in particular breast ultrasound, have a high rate of false positives. So we will find things which aren't breast cancer, but might potentially look like it, and eventually could even lead to a biopsy. But certainly for women that have dense breast tissue and that maybe have family history or are concerned about it, breast ultrasound is an easily accessible and a cheap exam to offer as a supplement.
Dr. Rogers, technology is moving lightning fast. What new advancements do you have in the field of mammography?
So an advancement within the last 10 years in mammography is what we call 3D mammogram, or it's also referred to as digital breast tomosynthesis. So essentially, if you visualize a mammogram, we're taking a three-dimensional object. On standard mammography, we're taking a three-dimensional object and creating two-dimensional images. So the difference then in 3D mammogram is that we take images of the breast from multiple different projections and put them together to form almost like a three-dimensional image of the breast. So a woman will still have, in a standard screening mammogram done with 3D technology, will still have two images done of each breast, but they're taken in at multiple different angles, so that we're able to get kind of like slices through the breast. Mm-hmm. And so when a radiologist looks through the images, he or she is able to have more images and get more data. So, we've had 3D mammography now for almost 10 years, and nationwide. It's been rolled out slowly, but almost 10 years. So they've been doing studies on it, and it's shown that it helps primarily in two ways. First of all, it detects more breast cancer than a standard 2D mammogram, but also it prevents as many callbacks from a screening mammogram. So fewer women will get asked to come back and get extra views on screening mammograms. So it helps in two ways. But so that's kind of where mammography is headed, and I would encourage women to pursue 3D mammogram. Not, even if you have dense breast tissue, it's shown to be really helpful, but also women that don't have dense breast tissue, it's still shown to be the best mammography test we have available.
So, Dr. Rogers, as a woman going in and getting a mammogram, whether it's for an acute issue or a scheduled, it can be very scary and kind of nerve-wracking. What would you say to a patient who's nervous about going in for this procedure?
First of all, I would say that it's normal to be nervous. Most patients are nervous or a little bit anxious about the exam. But the thing I would encourage women to keep in mind is that by pursuing a mammogram and by having your mammography done regularly, you're empowering yourself. You're taking control of your own health care, and you're putting yourself in control of your health care rather than just waiting for something to happen. So it's basically a decision that a woman can make to say that, you know, I can't control everything, but I can make this decision to get annual mammograms and do my part to potentially catch breast cancer at an early stage if possible.
That's an excellent way to look at it. Thank you. Dr. Rogers, another concern that women tend to have in regards to a mammogram is, does it hurt? Can you help answer that question?
Most women feel a mild amount of discomfort with mammograms, but it's not a significant amount of pain that should deter them from seeking out mammograms. We're just lucky that men don't have to have mammograms regularly, because they would for sure not be able to handle. But women are tough, so they can deal with it's just a little bit of pressure to the breast. Just to know what it felt like, I had it done, and it is a little bit uncomfortable, but again, just a small amount of pressure to each breast.
Excellent. Prevention is definitely worth it.
Definitely worth it.
Dr. Roger, another concern that women have occasionally is there any risk of radioactive exposure to women when they get these procedures?
That's a good question. The short answer is that there is minimal risk from the amount of radiation that we get with mammography. Like a way I like to think of it is there's background radiation that we all receive every year, and the amount of radiation in a full mammogram study, that's 2 images of each breast, is a fraction, maybe like an eighth of the amount that we would get from just a normal year of living just from background radiation related to the sun and other cosmic rays. So the amount of radiation, and that's how I would explain it to a patient, is a fraction of just like a normal year of living. Or another way to look at it is in Florida, if you were to move from Florida to Denver, the difference in the amount of radiation you would get just by living a little bit higher in Denver for a year versus Florida, that's about the difference in radiation that you'd get from one mammogram.
Interesting. So, to wrap it up, hardly any.
Yeah, so not a whole lot. About, maybe like similar to a chest x-ray or something like that.
Oh, okay, I see.
Yeah.
When we think of mammograms, we think exclusively women, but that's not entirely true. Explain to us when and what situations would a man need to get a mammogram?
So anytime a man feels a new lump or a change in his chest, in his breast area, he should talk to his primary care physician about, and potentially have imaging studies such as a mammogram or possibly a breast ultrasound. Usually in men, we start with a mammogram, and sometimes we'll supplement it with a breast ultrasound depending on what we see. Most of the time when a man presents with a new lump, it's what we call gynecomastia, which essentially is developing breast tissue behind the nipple in males, which happens to a lot of men as we age and maybe get a little bit out of shape and just get a little older. But breast cancer can present similarly to how gynecomastia might feel, especially in an older man. And most breast cancers in men present right behind the nipple. Mm-hmm. And so if a man feels a new lump, particularly around his nipple area, he should have it evaluated. Like you said, most breast cancer is not in men, but we do find breast cancer in men, okay, and find it regularly in men. And in fact, about 1% or a little bit less than 1% of breast cancers are found in men. So still, it's not a whole lot, but it's enough where men should be careful if they feel a new lump.
That makes sense. So guys really have to be paying attention.
Correct, yeah.
Thank you, listeners and viewers, for joining us, and thank you, Dr. Rogers, for being here today. And remember, October is not the only month to be aware of breast cancer. Breast cancer awareness is a year-long endeavor. Choose Radiology Specialists of Florida for your diagnostic and imaging needs.